Garmagat, Laskin Carla, and good morning, Minister. I'm very happy to be here today to move this motion, which is my first Dáil motion, and I'm doing so on my own behalf, but also on behalf of my very good colleagues in the regional group. I think as we've all lived through this year 2020, we can probably all appreciate there's probably no more deserving, no more fitting and no more worthy topic of discussion today than to discuss mental health resourcing in the country. It's a huge and vast area that requires absolute focus and absolute commitment, basically, to solve the issues that we have. From the get-go, I'd like to thank Deputy Dennis Naughton and our group parliamentary assistant, Courtney Cowley, who did a huge amount of research into this topic and also drafted the wording of the motion which we have before us here today. Also, I'd like to commend both the opposition and the government who've actually provided a lot of support for this motion over the last week, and it's actually very heartening and encouraging to see that is the case. And why wouldn't it be the case? Because mental health issues affect every party in this House, and indeed every house inside the country as well. I just have 3 points to raise, Minister, if I may. First, I'm going to focus on the situation in emergency departments from a mental health perspective. There's huge infrastructural under-resourcing from an infrastructural point of view in emergency departments. What we really do need is we need a dedicated pathway or a dedicated channel, very similar to the paediatric channel. When a paediatric patient shows up at an emergency department, they're actually routed through a particular pathway. We need exactly the same model for patients who are presenting in psychiatric distress or with a psychiatric illness, with a separate waiting room. The current practice whereby acute psychotic patients are interacting with general medical patients is completely unacceptable, and we really need to improve that setup. From a crisis team perspective as well, it's not good enough to just have one clinical nurse specialist on a crisis team. We really need to resource those teams properly, that they can deal with multiple presentations simultaneously and they're not completely stressed out themselves. And also, I would suggest, and I'm very happy to see in your programme for government, that there's a commitment to creating a director, a national director for mental health, with a direct line to Paul Reid in the HSE. And I think that's really important. And perhaps, Minister, you could mention in your follow-up at the end, where are we with that process, and is there a likely date for when a national director can be appointed, please? I guess the second thing I want to focus on, Minister, is mental health resourcing in the community, and particularly from an NGO sector point of view. And I know it's an issue nationwide, but focusing exclusively on Newbridge in my own constituency, there's an excellent agency there, an NGO called Hope D, who have about 1,000 service users on their books, but they get absolutely no funding whatsoever from central government or through the HSE. They're relying on the charity of Kildare County Council to provide 20% of their funding, and the other 80% they make up through fundraising or through donations. And I'm sure everyone can appreciate that relying on a GoFundMe page is not a sound basis to provide a very important service to the community. You're always distracted from providing that service because you're focusing on trying to keep the lights on and trying to keep the doors open. And the third thing I want to focus on, Minister, is, and I know it's an area that you have particular interest yourself, it's assistance and mental health of the elderly population. And I know from my own medical practice, there is a shift in the demographics of people presenting with mental illness over the last 12 months. And the shift is towards the elderly population, people who had no history of mental illness in the past, but now they're presenting with them as a result of cocooning, isolation, bereavement, and just loneliness. And again, I'm very happy to see a commitment on the programme for government that there's going to be a commission for elderly people, or care of the older person is the exact title. And again, in your sum up at the end, if you could indicate where we are with that process and when are we likely to see that commission in place, that would be hugely appreciated. So in summary, Minister, I think everybody in the chamber here, we can appreciate how precious and indeed how fragile our mental health is. And I think it's incumbent on us all that we ensure there's adequate resourcing nationwide, both from a HSE perspective and from an NGO perspective, for the betterment of the public at large. Thank you very much.